Hello viewers, welcome to another interesting and educative episode of Your Health on Impact Television. I am Precious Obatuishe, your regular host on the program. Alright, Your Health, like I always say, it is not a program to scare you in any way. It is a program that is aimed to help you acquire more knowledge about your health status, address health problems, and most importantly, your overall well-being. Do you know that infertility is a global health issue affecting millions of people of reproductive age worldwide? Available data make us realize that between 48 million couples and about 186 million individuals have infertility globally. Alright, this is a great issue of concern that should not be ignored. And to understand the subject of today in details, I have a special guest with me here in the studio in person of Dr. Olajide Emmanuel. He is a well-seasoned medical expert, and when it comes to fertility, he is well experienced. You're welcome to the program.
You're welcome.
It's good to have you.
Pleasure.
All right, let's start from the basis. Talking about conception, what are the things that are involved for conception to take place in a woman?
Yes, traditionally, people believe that just mating, that would be the issues. But the issue of fertility, I'm not talking of infertility now,
Okay.
require you to be in some particular state of the body, your mind, and even your thinking. Equally, stress could be a problem. So you have to be in very good health. Exercise very well. You must eat very well. Sleep at rational. You must not be overweight. You must not be underweight. So these are the conditions that could make you fatter. So when we're not talking of infertility, predominantly professionally or scientifically, we believe that unprotected cells, regular unprotected cells, for a minimum of 6 months or maximum of 12 months, a year, unprotected, I mean a sex you're having regularly, not when your husband is somewhere and you are somewhere. You make this love at alternate, especially during your ovulation period. This is when you can say you are not there was no consumption, no conception. Then you can consider yourself to go and see a physician or see an expert. Expert will better.
Okay, now that we understand what fertility really entails,
Yes.
So what does it mean to be infertile?
Infertility, like I've given you just a summary definition, is the conditions of traditionally between an husband and a wife. They go this between a childbearing age of a man and a woman. We know this puberty begin from some even 8. Let's say from your puberty to your mid-30. Any things above 30, that one is a discussion of another time. But in the situation when your body cannot consummate, the sperm cannot fertilize the ova, probably in the right position, then you should be considering yourself to be infertile.
Okay, thank you, doctor. So what are the, should I say, common causes when it comes to infertility in a woman before we now go to men?
Yeah, let's talk about general causes of infertility. Infertility causes are not known, but we can say, okay, these are some predisposing factors. Some condition you may find yourself, very thing you could do, you can consider very trivial, but it's very serious. When you smoke a lot,
Okay.
it could be a problem. When you drink a lot, it could be a problem. When you are overweight, it could be a problem. When you are underweight, it could be a problem. Apart from that, then we have some condition we can call, in a situation where you're having hormonal imbalances.
Okay.
That could be a problem. Then issues of obstruction in between the fertilization chamber, like growing something like tumor or blockages, that could be there. Then anovulation, a condition when you are not ovulating. These are some other causes. And this thing we talk about, even our morals, our casual, the way we behave, An husband living now, we are in Nigeria now. Somebody, you can look at the kilometer between here and Abuja. The husband is in Abuja, the wife is in Ibadan. Whichever one that is going there to meet, when you are even stressed, these could be some causes of infertility.
Okay, you made mention of hormonal imbalance,
yes,
and some other causes.
Yeah.
What could bring about
in women?
In women,
good.
What could bring about this kind of situation?
Yeah, like discuss with you about our eating habit, what kind of things we eat. Okay. The hormonal imbalance have to do with body hormones. Okay. The hormones that there are particular hormones in the body that have to tell the guy, we call it gonadotrophic hormone, to be produced. Among it are human gonadotrophic hormone, which is follicle stimulating hormone, luteinizing hormone, prolactin, the estrogens, and some other supportive hormones for fertilization. So of all these things are either deficient, not in proper position, or because it has a range. Okay. These are the issues that you can have. But your eating habit, when you eat very well, you go healthy food. I'm not talking about just eating. You eat a balanced diet, a native food, and your immunity is equally very important. These are things that affect your hormonal imbalances. When you take a lot of fruits, very healthy fruit, I'm not talking about rotten fruits. And you could see in Africa here, because even some of our spices, herbs. So these are some things that could result to hormonal imbalances. But okay, it is when you have poor pituitary gland function. But there's a particular gland underneath our brain, we call it pituitary gland. This is the gland that you have to stimulate. It's not now. We have the estrogen, progesterone, follicle stimulating, luteinizing, and some other hormones like that.
Does that work for both men and women?
No, the hormones there's a particular hormone in men that is all are called androgen hormone, but that is testosterone.
Okay.
The testosterone is the only problem a man could result to this oligospermia, then isospermia, or when you have even some problem with your sperms. Some sperm you may not have oligospermia, you may not have isospermia, but your spermia could be deficient. These are issues that a man could have.
Okay, aside from the obvious sign of pregnancy,
yeah,
what are the other signs that a woman, that has reached a reproductive age would see for her to know that this is infertility?
For a woman to quite identify herself to be infertile, like I said, you must have exposed yourself to unprotected sex. Unprotected cells. That means you are not under any family planning pills, you are not using condom, and you are equally having sex during ovulation. These are the issues. Then I'll be having sex in between. If you have a regular menstrual cycle, like let me just speak like 28 days menstrual cycle, you are sure you could be pregnant on your 14th day. But from your 10th to that of 19th are predominantly seems to be an ovulation period. If you have sex alternate days between this period, and you are not, I'm having unprotected sex, having sex.
So a woman that is not ready for sex yet,
without sex there can be pregnancy.
Probably the person is not ready for pregnancy.
Yes.
And the person is infertile.
Yes.
Is there any way that she could know?
No, but except you are inquisitive, you have to visit a lab.
Okay.
You visit an expert.
Okay.
They request for some test to see whether is your hormone balance.
Okay.
Okay, if your hormones are there, are you actually ovulating?
Okay.
Because you may have your hormone be proper, you may not be ovulating. So these are the issues.
Okay. How about situation whereby the woman has a first child?
Yes.
And then trying to have the second now become difficult. No child is coming again.
No.
What can you say about
these? These are due to rhesus factor incompatibility.
Okay.
These are more things in erythrocyte or in blood incompatibility. In every blood we have blood group. Then we have resource factor. We have resource factor positive and resource factor negative. A woman marrying a man is positive and a woman is negative. The first set of conception we escape. You understand? During that process, if you do not know your resource factor, your body will be developing anti-positive. I mean, a woman developing anti-positive. In any other conception coming up, the body will be rejecting it. That's when you say, I have only one child, I could not have others. These are the conditions that they find themselves. These are the predominantly the problem. Except after having a child, there was an infection, there could be blockage, there could be ingrowth of fibroid, or could be any other problem. Maybe you're sick, you have an accident. But those are the issues. But for you not to have a child and subsequently there is no problem, we predominantly will look at blood incompatibility, I mean resource factor incompatibility.
Okay, and that can be treated?
It can be treated. There is no infertility that cannot be perfectly treated.
Okay. Then let's look at the male. Let's go back to the male.
Yeah.
You mentioned some causes. What are the problems that are really associated with men being infertile?
Yeah, I told you your lifestyle. When you spoke too much, your sperm might be poor.
Wow.
If you drink a lot, your sperm might be poor. And if you are not resting, you are not exercising, your sperm can be poor. If you don't eat very well, your sperm might be poor. And long-standing sexually transmitted or even urinary tract infections could have a problem in me. But for the purpose of people understanding, infertility is a very broad thing, so that we bring our listener
so they could understand
into understanding. Let's just take, we are taking women, we can treat it for almost about 10 weeks. Because there are so many cases, like even some conditions of endometriosis. That is a condition, the internal linings of the uterus are supposed to be internal. The moment it's present outside the uterus, I call it endometriosis, it becomes so seeding, it's an infection. All these things could be a problem for a woman. But predominantly in women, there is this myth or this kind of belief. There is a witch, I don't know, beliefs that a witch can make you. But the kind of lifestyle you live. This obstruction could come as a result of rape or blockage of fallopian tubes. Understand? Even conditions of fibroid. But I used to tell people, and you should know, fibroid predominantly depend on the size. Will not make you not to be pregnant, but you are sure your baby and the fibroid will be contesting for space inside the uterus.
Okay, let's look at it in this way. In the society, infertility has been more associated to women. Once there is problem that has to do with infertility, they tend to focus more on the female.
Which society? Is it Nigerian society or African society?
Generally,
no.
Most times, in most cases.
You see, we are not living in a primitive age again. I think the last man in the bush has understood now that infertility are even more prevalent in men than women. The issue of stress is not easy. You wake up in the morning looking for money. And you see your state of mind too. You're not happy. You see this kind of thing we call sex. Your body have to be well associated before a person or a woman can say that you want to have this. You see, the issue of it is a woman and you have to go and check yourself. Even issue of sex is determined by men. It's what you plant, it's what you put in that will come out. That you are not expecting you put an XX or a very weak sperm, because even the shape of the sperms are different. The one for men, I mean XY, they have a tiny head, smaller and faster. But the one for a woman, their head is always very broad, tall and big. So it depends on the one you pour there. And it could depend on the situation your genital environment is. A man that put on very too tight pants, the area is not cool, it's hot, then you are sure you produce XX.
Okay, thank God. It's interesting that you have a fertility clinic.
Yeah.
Okay, from your experience, when people come for complaints and, as patients that are infertile, do they come as couple or you see a female, or you see a male, or you insist that you want to see both?
Yeah, you see, Nigerians are trickish. You see, any patient coming for infertility, maybe because of what it takes, most of them will start coming, I want to run a test that will make me see if there's anything wrong with me. It's when you are not able to put some question and answer, then you're able to see that this person is actually talking of infertility. Then you tell the patient, look, whether if I provide you, ask you question, or even run all scientific and forensic tests on you without your husband, my method of managing you might not be complete. The issues in those days a man will not follow me is not there. I used to tell women, though the method of managing a woman could be very slow and long. That of men, sit them down, talk to them, and let them see. This is the reasons. Have you been, you see, the issue of have you been infected with sexually transmitted? No, it's a lie. What about urinary tract infection? Sometimes, you see, so you have to think ahead of them. Since you are a fertility programmer, you think ahead of them. Even women. You know these little discharges they have.
Okay.
Hey, I'm having toilet infection. That's not so. Toilet infections are candidiasis that will not make you infertile. But there is terrible infection, STD, sexually transmitted, or UTI, untreated one. When I make a woman start having pains from the back, radiating towards the pubis, these are serious pelvic inflammatory diseases. These are situations you have to ask questions. Ask questions. You press them. They will not tell you. Whereas and in so you discover this is a male or a woman that is not giving you a tentative answer, you say, please, can you excuse me?
So how do you manage the situation?
Yeah, if you see probably the husband is the host type, is the bully type, uncle, please, can you excuse us? You ask the woman question, in-depth questions. Have you aborted before? Has this thing happened to you before? Have you been raped? Some people could not just mutter that courage to say, please, I've been raped. Somebody that was raped definitely must have been under the influence of drugs or alcohol or smokes. So these are issues you ask them. There is no person that takes these extreme drugs, the kind of a thing, they will have problem with their sex ability.
So how do you manage to pass the information or the message to the partner? Good.
When you want to help a woman, you try to tilt the problem towards a man. You understand? If you want to help a man too, you tend to tilt the problem towards the woman. You have to be giving your husband so food. You are the cause, so you have to dress skimpy. That doesn't bring fertilization. But you are trying to build the man slowly so that they can. Because in most cases, 95% of infertilities have an answer. Even if you could not get it, we have medical, which you have to get through drugs or injections, replacing the hormonal treatment. There are some with assisted reproductions. That we have IUI, artificial insemination, and intrauterine fertilization are done. And quite 100% you have a baby. All these triplets, in some of these are elite people. It's not natural.
Wow. That will be for another day.
So all these things, and I advise some expert, when you are doing your IVF, you don't plant only one seed. You can be very greedy, plant about 4 or 5. You are sure the body of the woman will absorb 1 or 2, leaving you with 3 or 4. And you have baby. And if the woman is highly fertile before, with your supportive medications, you go have 5 or 6.
Let's look at some of the risk factors that are associated with infertility. Okay. Let me start with menstruation. What is the relationship between irregular menstruation and fertility?
Irregular menstrual cycle. The people that have basic 21 days, basic 28 days, basic 32 days are better. Have it 28 days, this one come. You have to employ the service of an expert to help you target the ovulation. And the ovulation to God is so fantastic. The ovulation comes within phases, early phase, mid, or late. So if you're having, scientifically, if you're having 28 days cycle, you are too sure that on the 14th day from the day I start my menses, I should be pregnant. So, but we ask them to start making intercourse alternately from on the 10th. You have sex on 10th, or you have it on the 11th, then you have it on 13th, then 14th. But that 14th, we are sure if you're having 20 days, that 14 days from the day you start your menses, you should be pregnant.
Okay, so aside from the menstrual cycle,
Yeah.
looking at age, they always let us realize that age has one or two things to do.
Fertility diminishes in women with age. From your puberty, like the earlier you start your menses, start like around 8, it could extend to 55 years. But if you start late, like 24, 20, or even 18 above, you could stop. Because anything, a better time you can be pregnant from 18 to 30. Because from mid-30 is a risk. Mid-30. I'm talking about 20, 30, 35. All this kind of thing is a risk. At that time, so many things you don't expect, like fibroid, even with,
They start occurring.
you can be a virgin of, even people in the monastery. People in the monastery, they develop fibroid. Most of them operate fibroid. Most of these people in the monastery, I'm talking about our religion, our celibacy. So they develop fibroid and they have to undergo operation.
Wow. So what are the other risk factors that should be looked at?
I mentioned drinking, smoking, not having exercise when you are overweight and when you are underweight. But you have poor immune system. You are not eating a very good food, and you are not equally having sex as at when due. These are the problem.
Okay, there's this same research that talks about chemicals. And there are some certain kind of chemicals that
Exposition to radiation.
that affect fertility.
And
What can you say about that?
Those are occupational hazards. A woman now, that is a woman in the, what do you call them? People that show this radiologist or radiographer, there are limits to the levels of hormones and the radiation you take in. When you take too much, suppresses your level and your tinctures. So that is it. All these researchers, all this kind of thing. So every profession has their own protective gear. You don't underdo it. You don't overdo it. While you are still a student in training or a profession, it's like a doctor, a nurses, all these, even pharmacists. They are the worst drug addict people. That I know how I can manage it. If I do like it is true, you can be handling an emergency without blood touching your hand, but not everybody. Remember, your sweat or even drip of your hair dropping to the wound could cause problem. So you should be, if you are not protecting yourself, protect your client. So that's why there is a protective gear. If you are taking an X-ray, nobody say, let me just take there too. No. Take on the protective gear. Protect yourself. It's not like a soldier going to war front without bulletproof. Even a fly of bullet, if we are standing close to a person who has a bulletproof, if he hits, it can come back to you, then you are gone. So these are the issues.
All right, thank you, doctor. All right, let's look at some of the ways at which infertility could be prevented to an optimum level.
Yeah, generally, infertility is not a contagious disease. But all you could do is that you should do things moderately. Exercise moderately. I'm not talking of you people going to gym and start taking irons. Moderate exercise. Exercise is nothing, both a woman and a man can walk around, move around, makes you more healthy, especially to buttress your blood circulation. And to those who go to an official or this kind of banking or some other thing, if you don't walk around, there are so many accessories you can attach to your body that could do your massaging. You could do that. Either eat a very healthy food. Marry as at when due. Late marriages could be very funny. If you marriage at when due. From 18, but we Africans, especially African Americans and African Nigeria, Africa in general, We love education because we've been very poor for a very long time. So we love to use education as part of our lifestyle. So do it on time and do. And to you ladies or women of these days, I'm afraid. So anything you people are looking for, it is achievable. It's going to bring gender equality, any kind of thing could be very funny. You should STEM do. The levels of our religious teaching too is too bad. There are so much religious deceit in issue of fertility. Religious deceit. And you said if it's an African setting,
like going more spiritual about it.
It's not spiritual about fertility. Let a pastor come and face me. I have been to seminary. I know what it takes. There's nothing spiritual about fertility. Let no pastor deceive you. No oil. Something you talk and one pregnancy manipulate inside. They are all foul. They are foul. If you have, I was reading one pregnancy when a woman pastor. This is a fallacy. It's true. You see, these people I used to tell them, please don't deceive people. You see, we are very gullible. It's not just too fair that you just deceive people and think if you want to be pregnant, prevention, go to your church, just let your matter of faith do. If you have problem, see an expert. Even now this general practitioner, they will help you. Okay, this is if they cannot do it, they say, oh, I have a colleague, I have a friend, I can refer you to here. It's not every doctor can handle it successfully, but there are some people who have actually, after being trained, they are very gifted.
Okay, so at what point should couples, take this very seriously? At what point should they start visiting the hospital for checkups and other diagnoses?
Mentioned before, say 6 months after your regular sex. You make sure you are not overweight, you are not drinking, you are not smoking. This thing you can leave it sometimes. You understand? You can do that after your wife is pregnant. But make sure you follow the rules. But within the first 6 months of your having sex, unprotected sex, you can start considering. But what is a year? No, you have to visit a physician.
All right. Dear viewer, to be part of the program this afternoon, or you have a question for the specialist in the studio, simply dial the number on your television set. All right, let's look at ways of improving fertility. Are there basics? Are there ways at which, to an extent, we can improve fertility?
Yeah. Our fertility, improve your blood circulations is very important because there are reproductive organs. We're talking about from your vagina, your testes, and your penny, and your breast, and some other area that God has even created. God is very wonderful. The blood supply to all these regions are very vital. They are more. The blood supply that supply your extremities are not the one that supply the uterus. The uterus has to supply right from the right and left. And so it is in the breast. So it is in men and in women. So increase your blood, eat a very good food. Rest well. Less stress, mister. Because I am talking about stress. You cry a lot, you are not happy, you agitate a lot, you are not sleepy, you take a lot of things in your mind. You will be pregnant. You see, you would consider, I want to just digress a bit. There is no scientific proof of to this, like you see a mad woman.
All right, we have a call here. Hello, good afternoon. Hello, good afternoon. Kindly move away from your television set. Good afternoon. Please move away from your television set so we can hear you properly.
Hello?
Hello, I'm with you. Your name and where you're calling from. Hello? Your name and where you're calling from.
Okay, my name is Sarah. I'm calling from Nasarawa State.
Okay. Your question, please. Hello?
My question is, there is one of my friends that for long she's not in her menstrual cycle. So the solution or maybe the cause Please, she married for some years and now no pregnancy because she's not seeing her menses at all.
Okay,
That
okay.
is my question.
Okay, thank you for calling.
Madam,
We'll see to
before,
that.
before she go, is she the person
Okay.
or a friend?
She said a friend.
That's always the question they say. Because if she's the person, there are questions I could have asked her, what is it? If she has not seen her menses before, she should visit a doctor, visit an expert. I'm not saying just, I have not seen my menses, just give you some funny tablet. They have to go to the hospital with something called hormonal profile. It's because if your hormones, the hormones that are supposed to be in your body system are not there can't be menses and there won't be pregnancy.
Okay, you've answered that.
Yes.
Let's go back to, you mentioned fibroid earlier
Yeah.
during our conversation. What does fibroid has to really do with pregnancy?
Good. Fibroid is just the non-cancerous.
Okay, we have
growth.
another call here. Hello, good afternoon.
Hello,
Good afternoon. Your name and where you're calling from?
my name is Gloria, calling from Jos.
Okay, your question, please.
Okay, my question is, I'm calling on behalf of a friend, a co-worker. When she got married, she visited the doctor, and they told her that she needs to, she visited the doctor, and the doctor told her that she was having an infection.
Okay.
And they said she needs to wash her womb. I've never heard anything about washing the womb. Please, I want to ask the specialist. Is it true that they wash womb? She said they carried out a washing of womb, that they washed her womb, and she said she's still expecting.
Wow. Okay, we'll see to that. Thanks for calling.
To that question, the word washing of the womb is primitive. What they are just talking about is evacuation. Now, if they claim she is infected, that is not the first actions. If she is infected, the infection will be treated. Some go a step further. To clean all the debris. It's not like going to war. Yeah, you shoot and there are people that you drop some terrorists now died. If you don't take them and bury them, it will cause infections, cause cholera. It's like when you treat infections in a woman's womb, there's some people who could take a step and get her evacuated. Because the uterus, to be able to house and accommodate a fetus, it must as clean as our inner throat. You know that reddish?
Yes.
Our vulva used
Yes.
to be. I'm not talking about your tongue behind. That clean something. If it's not as clean as that, the inner lining of the uterus must be very clean. If it's not clean, due to infections or care, and towards the north, people, I tell please, this issue of taking care of your private or genitals, do not use soap to wash your genitals. Women, please listen. Do not use soap, don't use detergent, don't use cream to wash your private part. If you do that, there is a particular gland that God has created along that region, the vaginal canal. They are called Bartholin glands. These are something that secrete. And then again, the entrance of the womb, which is we call the uterus, there's a particular mucus that's supposed to be there. That grease and make the place jelly. If they are dry, those things cannot be there. So the word of cleaning your uterus, they are washing it.
Hello?
They don't wash it.
Okay, hello, good afternoon. Hello, good afternoon.
Yeah, good afternoon. My name is. Hello, good afternoon.
Your name and where you're calling from, please.
My name is Toy from Lagos State.
Okay, your question, please.
My question goes to doctor. Please, what really caused the fibroid? And I want to know the reason why it caused the infertility for the pregnancy.
Okay, thank you.
That's what I'm about.
We're actually discussing about. I asked the question that has to do with fibroid.
Fibroid is a non-cancerous growth in the uterus. I repeat, it's non-cancerous tumor or growth within the uterus. It could be inside the womb, which is endometrium. It could be inside the muscle, intramedulla fibroid, and it could be outside the uterus. We call it pendiculated. These are location, these are areas. Some are very close to cervix, some are close to the back. These are areas. What happens? You see, when the uterus, you see a ball, just a ball, it is sticking and it's elastic. I should come again, but more literally, we can use a ball now.
Okay.
You now buy a ball and you did not pump it. You understand? You know why you see this ball that will play? On pumping as very small. You now leave it for a very long period. You understand? The possibility of that thing being breaking from inside is very high. So same to the uterus too. If your uterus is not carry baby for a period of some times, before we said 35 years, now we see fibroid of 24 years.
Wow.
Yeah. And this thing begin to grow. But the earlier you see it, the better. It can be removed. That condition is called fibromyalgia. It too can be removed and nothing bad. You will be pregnant. Now say the causes, because it induces an obstructive in the sense that if the fibroid is going by the cervix, by the cervix of a woman, cervix means the entrance is going to block, and when sperm are coming, they are supposed to go down straight, slippery, and transfer. It's not like, okay, somebody is standing up, you now put it. Sperm cannot be climbing now. And when you see a river that flows, they flows through the valley, and the lower they go, the speeder they be. So when your own is now higher, no river flows towards up. These are the issues.
Wow.
They are like tomatoes shape.
Wow. Good afternoon.
Good afternoon.
Your name and where you're calling from?
My name is Sunday. I call from.
Please kindly stay away from your television sets. Stay away from your television sets. Kindly stay away from your television sets.
Yes, I call from Sunday.
Okay. Your question.
My name is Sunday. My name is Sunday. Please, I want to ask if after a woman gets menses finished, how many days where a man can contact with her?
Your question again.
My question is, I feel if
We lost that call and we didn't get the question exactly.
I think he's trying to say that after
Okay.
how many days? Sir, just give your wife 2 weeks. After menses, just give her 5 days after or 6 days after. You can begin to see your wife.
Okay, so we're still discussing about the relationship between fibroid and
The
pregnancy.
fibroid occupies spaces inside the uterus, in between the muscles of the uterus. It doesn't have anything is secreting. It doesn't secrete anything, but it occupies the spaces. And you know when you have a baby too, the water there expands the uterine
So
muscle.
they both fight for.
And they start fighting for space. That is why it could cause habitual abortion. You get pregnant in 3 months, it comes down. That one too are usually some hormone, because some after being pregnant in 3 months the levels of the hormone just drops, and the pregnancy might be loosed.
Okay, as an expert in this field, and with your experience with probably several patients that are in this condition, can you share some of the treatments, some of the management, and probably there were solutions that you could come out with?
The truth of these things of management, we have self-management, even self-examination. We have some management you can take, which is then we have special management. Your self-management is like we said, eat well, do this well, sleep well, do this. Then if you are not ovulating, if you can equally run some tests, you can take some, there are ovulation tests. There is a particular drugs, is very, very common. Most of all these infertile people knows. They are clomiphene citrate. That's what I'm going to say. that's the chemical name of the drugs, are mostly used. That is if you have an ovulation problem. But if you are not having an ovulation problem, your problem is to hormonal, you have to go for hormonal therapy. You understand? If you're having fibroid, you have to go for surgery. So that is done. So if you are overweight, you try to shed your weight.
Hello, good afternoon.
Hello?
Hello, good afternoon. Your name and where you're calling from?
Good afternoon. My name is Happiness. I'm calling from Oyo.
Or your state?
My name is Happiness. I'm calling from Oyo.
Okay, your question, please.
Yeah, please, I want to know what really caused. Yeah, I wanted to ask the doctor what really caused ectopic pregnancy.
Yeah.
Okay.
Ectopic pregnancies are usually caused by blockage. Ectopic pregnancy is a condition when a fertilized egg refuses due to the obstructions of ring or wrinkles, could not move from position of conception. Conception doesn't take place in the uterus. It takes place in the ampulla. That means after the sperm must have swimmed into the uterus, it travels in between the fallopian tube. When conception takes place there, then the fallopian tube are just like a tube, just like an esophagus. You know, when you take a morsel of food, that thing swallows down, it pushes down. If there is constriction or blockage, that egg cannot come into the area where it could develop. That condition is called ectopic. Ectopic. And not only in that area, some even have their pregnancy rising inside the peritoneum. But when the ova releases and the phalanges of the fallopian tube just picks it, it could be conception there. Could not come into the right place to develop. That's what they call ectopic pregnancy. Most of all these things are caused by infections, obstructions, wrinkle, like we are saying fibroid. The sperm can escape these obstructions and went into the fallopian tube, got concepted there, and it cannot go. So these are conditions that will result to ectopreg.
Okay, is there still hope for couple who are experiencing infertility?
100% hope.
Can you tell the viewer at home what?
My candid advice for every couple looking, they call it, there's a way we call it in Africa. They say they are looking the face of God. What do they call it? You visit an expert and then give you proper advice. And if you receive a better management, I want to assure you, within a year or 1.5 years, you should be pregnant. There's no cause for anybody scientifically now to say, I'm not pregnant. If you cannot, there is assisted reproduction. IUI, intrauterine insemination, IUI, intrauterine insemination. And taking the sperm, introducing it into the uterus, and getting fertilized. Then IVF, intrauterine fertilization. So those ones that could be there as well.
Thank you, doctor. What is your parting shot on the program this afternoon?
We should just be healthy and keep healthy. We should sleep well, eat very good well, exercise, and do which is needful.
All right. Thank you so much, Dr. Olajide Emmanuel.
Welcome.
It's good to have you on the program,
It's
Your
a
Health,
pleasure.
this afternoon. All right, dear viewer, this is where we're going to be calling it a wrap on the program, Your Health, this afternoon. Till next week, when I shall be coming your way again, same time, same station. I am Precious Obatuishe. Stay healthy, stay safe.